Okay, if we could go ahead and have everybody's attention, we'll go ahead and call our meeting to order. This first meeting of the year, Monday, January the 7th. I would like to welcome everybody here. Thank you for coming. Look forward to hearing from some of you, and maybe all of you. That'd be okay, too. We have had some requests to maybe try to keep the meeting short because there's a ball game on or something tonight, but we'll take care of the people's business as efficiently as we can, and that's first and foremost. And then if we get done in time, we can turn them loose and let them go watch a ball game. So, are there some agendas back there? Okay. Of course, you can follow along on the overheads. At this time, we'll go ahead and call our meeting to order and invite everyone to stand and join us in the pledge. And I've asked Commissioner Osborne to lead us.
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let us pray. God, we thank you for another year. We thank you for all your many blessings that you bestowed upon us last year. Lord, we pray that you would just continue to watch over us, lead and guide us, and just help us to understand the importance of every decision and everything that comes before us, and help us to make the right choices for the betterment of all in this county. Thank you for what you do, and thank you for watching over us and allowing us to be a part of this board. Let's pray that you would go with us, lead, guide, and direct us. In Christ's name I pray. Amen. We do have one requested addition to the agenda as Nick Hawks from the Sheriff's Office, and we will propose to include him under presentations C2, and I think that's all the proposed amendments we have. With that, I would entertain a motion for approval.
So move.
Second. Motion and a second to approve the agenda. All in favor, make it known by saying aye.
Aye.
Opposed, no. 5-0. Also in your packet, you have minutes from our 12/17 meeting. Any questions or concerns regarding those? If not, would entertain a motion for approval.
Hearing no changes, I make a motion we approve. Second.
Motion and a second to approve. All in favor, make it known by saying aye.
Aye.
Opposed, no. 5-0. Thank you, Drew, for those minutes. Okay, we'll move along to item A, Chamber of Commerce. I think we have a spotlight business. What's listed is Blue Ridge Grill. Sometimes that does move around a little bit, so we'll wait and see. Welcome, Jordan.
Thank you. No surprises tonight, Commissioners. It is Blue Ridge Grill. A couple of chamber business items really quick. I wanted to tell you all that we will be bringing business after hours back in 2019, and I'm happy to report that we have every month scheduled for 2019. So really excited that we had such a positive response from our merchants and chamber members that were really excited about bringing it back, and we have a large variety of after hours scheduled. If you want to know when the after hours will be, and if you want to go ahead and etch them in your planner, we have them on our Facebook page, and Sarah Dalton is going to have them on the Authentically Alleghany calendar, website, and app as well. So we're really excited about that. And our first business after hours of the year is actually going to be this week. Maina Wyatt has been with the Chamber for 10 years, and she is going to retire on January 15th. So our first business after hours is going to be January 10th from 5 to 7, and we have coined it Maina on Main because we are going to be celebrating her tenure with us and also her retirement as well. And we are looking forward to showing off the newly renovated chamber offices and visitor center as well, because a lot of the public has commented that they didn't know that the chamber looks so nice. So we're going to see if we can get a couple more of those people in there to compliment how good it looks. And also coming up this week, we have a ribbon cutting on Friday, January 11th for H&R Block. They are under new franchise management. Crystal Bolt is going to be the new owner there, and she's going to have sort of an open house from 1 to 6, but we will be having a ribbon cutting ceremony for her at 2 o'clock, and Trojan Patio will be providing refreshments, so you can stop by and support 2 chamber members there all in one. And next we're going to our spotlight business. I had hoped Gary would pop in. Maybe he's bowling a game before he was going to come, so I don't think he's going to be able to make it. But I was really excited to do Blue Ridge Grill because I got them to join the chamber last week, and sometimes it's a little tricky to recruit people to be chamber members. I think it takes at least 3 phone calls and 2 face-to-face visits before I can wrangle them in. But Gary was an interesting case because the first time I called him, he said, "No, thank you. I'm working on a school supplies drive." And I thought that this was the kind of man that I wanted to have as a chamber member because he was really dedicated to our community and to our youth and to our school system. So Gary has owned Blue Ridge Grill since August 1st of 2017. He also manages the bowling alley and the backroom bar, which will be opening January 11th. It's going to be a really cool spot. They have a stage there and a little separate area up top. Gary's really committed to our youth, as I mentioned before, with his dedication to helping with school supplies drives and also helping with angel tree donations and things like that. It's one of the things that really got me interested in getting to know him a little better. And one of the great things about Gary is he has a really interesting marketing model. So with the Blue Ridge Grill, he really focuses on creating innovative events that not other restaurants or businesses in the community is doing. So on New Year's Day, he actually opened up at midnight, and he had free pancakes until 3 o'clock in the morning. So nothing like getting new customers like pancakes on New Year's Day. At least that's my motto. And I really enjoyed kind of talking with him about some of the future events and things he wants to do. He really wants to start a community youth coalition, and I was hoping he'd be here to kind of talk about that here tonight because he wants to use his business to help out the youth in our community, and I just think that's really great in both a business owner and a member of our community. And I think his innovative dining with the 3 parts of the bowling alley and the backroom bar and the Blue Ridge Grill really make him an interesting chamber member, and I'm excited to spotlight him tonight. And look out on our chamber Facebook page. We'll be providing more information from Gary about some of his upcoming events. Do you guys have any questions? I'm sorry.
Couldn't breathe.
Not really, no. I'm really tired. I got to work hard to get all these business after hours scheduled,
You
so.
did great. Thank you.
Sounds like you've been very busy, and I have noticed social media has been hopping pretty good with events and things, so just keep up the good work, and I'm sure it's going to translate into positives for our community.
I hope so.
Yeah.
Thank you, gentlemen.
Thank you. Okay, we'll move along to item B, public agenda comments. If there's anyone here who'd like to address this board on any of the items on the agenda, now would be the time to come and make it known. Seeing no movement, we'll move along to item C, presentations to the board. We have with us some representatives from the Health Department, Ms. Jennifer Green and Elizabeth Curley. Do not. That'd be fine. Always need some good reading material.
Happy New Year. This is Elizabeth Curley. She's one of our awesome team members and has done a lot with substance use prevention and treatment in our Free County area. So a lot of what I'm going to say is related to her hard work, but we'll get right on here. I guess it's been a while ago, the county actually hosted a opioid summit and really encouraged action in the community to try to address this crisis that's affecting our whole nation, including all of our surrounding counties and our communities too. And we see this in a lot of different ways, not just in substance use, but also in things like DSS cases that increase because of social services having to intervene related to substance use. And there's a lot of costs involved. And from a public health standpoint, one of our biggest concerns is often related to dirty needles and the fact that, several years ago, if you all remember, when the AIDS epidemic first came out, we were all terrified, and it seems like with more time, that's not as scary anymore. But guess what? Hepatitis is still out there, HIV is still out there, and because we've done so well with controlling prescription drug access, we've got more controls in place now with prescribing pills. There's more that we need to do, but that's transitioned people to do, a broader array of drugs, and it's because they are addicted, and there's certainly evidence that shows that that is a disease. So what we wanted to talk to you about tonight is really some of the statistics, but we are working hard with our partners on this, the Alleghany Wellness Coalition, and I just want to say we've applied for several grants. We have been able to get some grants. We're going to highlight that a little bit tonight. But you have in your packet the Board of Health resolution, and I wanted to make sure to call your attention to that. This is something that Commissioner Irwin, Bobby Irwin, sits on our Board of Health, and we had full support from our board for this. As you all probably know, the governor's office actually adopted a opioid action plan, and it's based on evidence that is proven to work to try to help stem the tide with the rise that we see with opioid problems. So it's comprehensive in nature, and I wanted to make sure you saw this. So here, a couple of things that we've done at the health department on the clinical side. We have integrated behavioral health with our primary care. That's something that we've been able to do because we're a community health center, and we've applied for some additional grant funding to support that. So we have a counselor on site, and soon we'll be implementing substance use screening, and that's mainly to try to meet people where they are. It's to allow us to lower the stigma related to getting help and making sure that that's part of someone's overall care. We also have gotten some additional funding. Dr. Ainge, our medical director, many of you probably know her. She's actually gone through the first series of trainings to do substance use treatment. And so we have a plan to work in opioid use disorder treatment in the future within our primary care patient population. The other thing that we're going to talk about a little bit, and I'm glad that Nick is here, we'll be talking a little bit about our partnership with the Sheriff's Office. And I'm going to let you kind of highlight that a little bit, Elizabeth. But what I want to point out too, we do a community health needs assessment. We did bring that to you all several months ago, and just want to point out that substance use, alcohol or drug use is the #1 health concern among the residents that participated in our survey. So just want to make sure that that's something that we point out to you because it always comes out as a top concern among the community members, which is another reason why we are working towards this. Okay, so I've talked enough here.
I'm sure I'll give the mic back. Okay. Thank you all for letting us come tonight. So I just wanted to point out some data, some facts that we have collected throughout the needs assessment. And these are particularly interesting from the Injury and Violence Prevention branch with the Division of Public Health. And these are just really neat to look at because it kind of tells where we're at in our region versus where the rest of the state is. And so these are the rate of medication overdose deaths by county. So this was in 2013 to 2015. It takes a little while to collect all of that data from all different sources, but the state does a pretty good job of that. So as you can see, we're kind of, as a region, we're kind of in the mix at 18.4. In comparison to the state of 13.5, that is significantly higher. So again, it just shows another point of why we, as a public health department, need to focus on this, and as a community, why it's really important to hopefully decrease those death rates. This is one that I really do want to point out that I think we have done a really wonderful job as a community collaborating on. This is the number of pills dispensed per person in Alleghany County. So that doesn't mean everybody that's walking around has 88.5 opioids hanging out in their medicine cabinet, but it does mean that for those people that are receiving those medications, that's a pretty high number, especially in comparison to the state where it's dispensed per person is 66.5 if you're looking at that spread across the whole state. So one of the things we've done, and Western Youth Network, which is the prevention agency for our area, has done safe prescriber trainings, and they did several last year, and I wanted to let you know, we don't have the dates confirmed, but they're going to be doing more safe prescriber trainings this spring to talk with medical providers all across the board about how to appropriately dispense medications, new research that's come out on, the effects of opioids and the harms that it can cause on our society and them individually, to hopefully rein some of that in. So there's definitely active steps in place to work toward that and lower that number.
Has there been some legislation passed to help kind of police that?
Yeah, the STOP Act limits the amount of prescribed opiates you can get as a outpatient, and certainly allows us to have a broader access to naloxone or Narcan, the life-saving reversal drug that's out there now that you can get through pharmacies. And we actually are working to try to get that at the health department so people can come and get it from us too. I know that our law enforcement often carry it, and first responders. It's a very important drug too that came through that legislation.
Very expensive one too, I understand.
Yes, which is another reason why we're trying to work on this, to give more access to people who need it.
What's the approximate cost for the naloxone?
I think it varies. I mean, the last I heard, somewhere around $60 or something.
So there's two different types. There's one that's an intranasal spray that's really easy. It's about $150 a box, which comes
Yeah.
with 2 doses.
Yeah.
If you're doing another kit which has it has syringe and a little vial that you just use there, and again 2 doses in, they run about $55.
Yeah.
Significantly less than I had been told.
Well, that was also what we were trying to hope to get it for. I don't necessarily know that that is the same pricing that is given out to the general public per se. But that's what, when we were hoping to purchase it, that's what.
So that's
we were
about
looking
what we pay in the ambulance service.
Okay.
I know that's pretty close to what we pay.
No limits on how many times a person, if they overdose 6 months later, hit them again?
That's right. And those who have used it more in the field are, well, better versed than I am, but our understanding is there are times when multiple doses are needed, particularly with fentanyl that is being mixed with drugs now. It can cause you to need multiple doses for it to actually fully reverse. So it's pretty important drug to have out there in the community. And
I listened to an NPR presentation where there are counties that are now refusing to give. If they overdose a second time, they don't get it because of the cost.
well, that's
Oh, can you go back one slide?
yeah, sure.
Looking at North Carolina, we're in, I guess, the red part
We
for
are.
Alleghany.
Yes.
How do you determine these numbers, or who determines them?
Well, it comes through the state in the injury epidemiology unit. I will say, one word of caution about these numbers is they are always a little bit delayed, and that's because it just takes time for that information to come through. Really, a better measure for us to be monitoring is the death rate, which sounds awful, but we do know that the legislation has passed, the STOP Act, which limits the amount of prescribed opiates that someone can have, and really requires access to the Controlled Substance Registry. I'm saying that right? That is something that allows us to identify if someone is doctor shopping, so to speak, if they're going around and they're going multiple places, which in our dental clinic, we've certainly seen a couple of cases of that.
Does this include drugs that are mailed into the county that are purchased out of the state or purchased out of the country?
I believe it's primarily purchased here, but I'd have to look up the data to really dig through it and answer your question accurately, I think.
Do you see the numbers for Alleghany County being high for a county the size we are?
Yes. But I also think that this is a problem that requires a comprehensive approach. So the pill access is one part of it, but the overall problem is related to, we've got to make sure people have access to behavioral health. We need to be encouraging our primary care providers to do more screening so that they see if people are at risk for substance use disorder. And let's be honest, the access to treatment is pretty limited. And it's not because our current providers don't want to do it, it's just because our system is limiting to that. So that's one of the reasons why we've been working towards getting that integrated in the health department. It's not going to fix everything, but our hope is that it will absolutely help our patient population who, we see people regardless of their ability to pay or their insurance status. And so hopefully that will help with whomever might need that access to treatment. I think this is one piece of the puzzle, I guess is what I'm trying to say.
Is there any way to track what doctors or how many pills individual doctors prescribe?
Yes, and I do believe that that is being tracked more now than ever. And there are medical boards who have made, clear statements about that. That's part of the STOP Act that was passed in, I think it was 2017, early 2017 or late 2016.
We're a lot older. We're one of the oldest counties in the state. Median age here is 47. Median age in Mecklenburg, for example, is 32. So we have, proportionally, we have more older people, less younger people. And, somebody that's 10 is not very likely to have opioids prescribed compared to someone that's 70, And that skews our data a little bit as well,
You're right.
As you see, Mecklenburg's really low on this chart, but again, they're a younger county, so.
Really, all you're giving us is the known statistics. We don't know how many opioid pills are being sold by the local pusher that have been brought into Surrey County. I mean, we know that Interstate 77 is a major trafficking area. Galax is a major distribution center for the cartels. It's well known, isn't it, Nick? We don't know how many of those pills are coming into the county. We're just looking at prescription pills. So we are looking at the tip of the iceberg.
And that's important to keep in mind, that these are the pills that have been dispensed through the pharmacies. So, it is, and
Sure ain't going to tell you how many he's pushed.
correct.
Yes.
That's exactly right, which is one of the things I was going to touch on in conversation, and while we're working again with the Alleghany Sheriff's Department, is because that is just the tip of the iceberg. What we're seeing throughout this research, and in North Carolina definitely, is that while there's been more education around prescribers doing safe prescriber trainings and stuff, we're decreasing the amount of those prescription opioid pills, but we are seeing an increase in illicit drug use, particularly around IV drug use. I'm sure most of you are aware, I know when I had a meeting with the Sheriff's Office on Friday, methamphetamine is still a huge problem in our area, not just in Alleghany County, but in our region. It's a problem across Appalachia. And so that is still an issue as well. One of the problems we're seeing to compound that is what Jen was speaking to about the fentanyl being mixed with these new drugs. So not only do we still have a meth problem in our area, these drug manufacturers are pressing it with fentanyl, which brings it back to the opioids, which means, again, people don't know oftentimes that the meth that they're using has fentanyl in it. So it just really compounds this problem. It makes it really complex, and it's already really complicated. I'm going to go through the numbers really more quickly just because honestly. Like, numbers tell, but stories sell. So we're going to talk more about the other stuff, and this is really important, but I want the opportunity for y'all to ask more questions too, and I really want to talk about the cool work we're getting ready to do with the Sheriff's Office. So this, again, is just undetermined prescription opioid overdose deaths and rate of outpatient prescriptions dispensed for opioids. We're pretty much in line with the state if you look at this chart, which, again, all this data kind of fluctuates. But, yeah, we'll go from there. So the last data that's on here is 2016. So as you can see, the trend line has been trending up. The data I pulled this afternoon does show a decrease in that. However, I will say that I pulled it for 2018. I think data is probably still coming in since we're very new into 2019. So I want to caveat that. But what I pulled most recently was from Alleghany ED, and that showed we had 24 patients that presented at the ED with overdose being somewhere in their triage notes, somewhere in those diagnosis codes for their presenting issue at the emergency department. So again, it's new data. That's why I didn't want to put it on here in the slide, but I did want to note that hopefully some of these things that we're working on are impacting what we're doing already. It just shows that that's still a high number, and we definitely still have some more work to do.
Maybe not.
Yeah.
There we go. Okay. You hate to talk about numbers when you're talking about the worth of someone's life, but that is what we're kind of looking at sometimes. What is it that we're losing when we have individuals and these persons who, have this disease of addiction? And so just looking at this is thinking about the medical and work loss or medication and drug fatalities through all intents. So that's a pretty significant number. If you're looking at that combined cost between medical costs and work loss, that's a significant number. That's over $2 million. So thinking about really another reason why we have got to move on this and really come at this from multiple angles is the cost to the community. I know Alleghany has done a really beautiful job on your economic development and where you're going, and so we want to keep heading and trending forward and moving forward with that. And so tackling this as part of that is definitely going to be a really key issue.
Some more statistics.
The only thing I wanted to note about this is something that I've always gone, that's interesting, is that Alleghany is a little bit different as far as some of the other counties in our area. Not necessarily bad. I just want to note that typically you see more males than females, and typically you see a higher age range. It looks like for Alleghany we have a younger female population who are presenting for more overdose deaths in our community. So it's just something that it makes me go, I wonder what is impacting that. And I just wanted to call that to your attention. So usually it's more male, and usually they're in the 45 to 64 age range as the majority of that. But it just makes me ponder and wonder how we can really kind of target young women, especially in our work. So I also want to call to your attention, we have been doing, last year we launched a media campaign around naloxone, and this is still live. So this is savealifenc.com. You can still Google it. We are getting ready to relaunch a new campaign, the second phase of this, with some of the grant funds that we have received. And so this is going to be really important because we want to specifically target Alleghany for part of this media campaign to do more education around the Good Samaritan's Law, around some of the work we're going to be doing with the Sheriff's Office around what naloxone is, so the community members can really know and understand, because it's still kind of new, and a lot of people just don't understand what harm reduction is, and that it doesn't have to be this really scary thing, and really the science behind it and the evidence behind it and how it really can get people into recovery and into treatment in the long run. So I just wanted to share this with you all, that to be looking in the coming weeks and coming months for more media, especially on Facebook, and we're hopefully going to be doing some with Alleghany TV as well. We're working with Tim Baxter Marketing Company, and they have done a phenomenal job in the past, but we're definitely going to use some of the grant funding to target our community specifically, and we're having an Alleghany Drug Abuse Coalition meeting in a couple weeks to talk about more of the specifics in here, and we're going to bring that back to the Alleghany Wellness Coalition and get their thoughts on that too, to make it really specific for Alleghany.
I just want to point out, Dr. Ainge is in one of the videos demonstrating how to use the naloxone drug, so.
Okay, so the last part of this, before I talk about the grant we received in collaboration with the Sheriff's Department, is the health priorities. Jen mentioned the community health assessment. I just wanted to list these out here, that mental and behavioral health, substance use and misuse prevention, and then health equity for a vibrant economy, how closely tied all of those are together. We're very fortunate that the Alleghany Wellness Coalition is going to act as our steering committee around these goals and helping us implement some strategies in the community to target these. But I just wanted to let you know that we'll be working on those through 2021. And then we'll be doing another community health assessment. And again, just checking in with the community and realigning these priorities to make sure we're on track with Alleghany County. I think that's all with the slides. I believe the next one is probably a thank you. It is. So again, more of that data is in the community health assessment. It's on our website, apphealthcare.com. If you go to community health, you'll find a reporting tab, and you can find one very specific to Alleghany. The last thing I wanted to note that is the most exciting is our collaborative work with the Sheriff's Office. So I believe in your packet you have a memorandum of agreement, this contract that we entered into. We received a grant called the Emergency Overdose Grant, specifically for Alleghany, and some for Ashe County as well. But our primary focus is going to be Alleghany for this grant. And I may have, Nick, do you want to say anything with that before I get going, or do you want to just chime in? Okay, all right. So with that, what we're hoping to do, and I just sent it to our HR director today, we're going to be hiring a peer support specialist. And within that, what we're hoping to do is really have them work with the inmates that are in the jail. We're going to be doing some, like Jen was saying, more substance use screening upon intake to make sure that we're catching the individuals who have a substance use issue when they're coming in, connect them with this peer support specialist, and then hopefully connect them with education, treatment options, and other community resources. So we know that our officers don't have time to really stand there and walk through and make all these phone calls. So we're really hoping that this position is going to start building those relationships, especially for the individuals who are in there a lot more than we would like to see them, and hopefully craft those relationships and really walk them through what it's going to take when they get out to make a change, because we know that's really difficult, and we know that it is often a long process, but hopefully this peer support specialist will be impactful in that. Jen also mentioned that we're hoping as a health department to distribute more naloxone, so that's part of this grant as well, ensuring that, our clinical staff is trained, ensuring that we get naloxone to appropriate agencies in the community who may experience an overdose either on their grounds or a family member, and again, educating the community will be part of that media campaign as well. I think, and that runs through August of this coming year. So
This board is painfully aware, our last meeting, we had to do a $55,000 budget amendment because of the increased incarceration. And, I don't have man-for-man statistics, but I know 90% of that is due to addiction issues. And if we can help address, if we can clean one or two of these people up and help them recover and become productive citizens again, everybody's better off, the taxpayers, society, everybody, the individual, of course, and their family.
absolutely. Does anybody have any questions about that? I know that I went through that really quickly, but it's something we're very excited about.
That $2.5 million cost kind of stands out, that, if we can start cutting into that, albeit one bite at a time. I don't know what our actual recidivism rate is, but I know y'all get tired of, seems like you bring them in one door and they go right out the other one, and, the courts are doing what they know to do, and it just seems like there's not enough help, but some intervention here hopefully will bring some education that will maybe start to enlighten some of these folks. I would ask you to touch on, you mentioned Alleghany Wellness Coalition a couple of times. It's something relatively new that's just kind of been visited here. And would you share just a little bit where that is, what that is, and kind of how new it is and what's going on with it?
So we have always worked in partnership, but what we've been trying to do is formalize it a little bit more. Recently, we've been sort of corralled. Craig James, who you all know is the CEO of our hospital, and Fred Fender, a very active community volunteer. We have been working with them as well as many other folks in the community to try to present our community health needs data and really try to bring folks together to talk about what should we be doing about these issues. We had our first meeting. Thank you, Commissioner Evans, for coming to that. And just want to say, I feel like a lot of these things that we're talking about, they're public health issues, but they're really community issues. They're not something that one agency can solve. And so our goal in that is really to try to build partnership across the community, the hospital, and the healthcare, but also businesses, education. We've already implemented a new tobacco education curriculum with the support of our great superintendent, Mr. Beasley, so through that connection. So I think there's a lot of opportunity for us to continue building on that, and I'm hopeful that we can come back and give this group an update from the Wellness Coalition partners in the future about what we're doing. Yeah, thanks for asking.
Yes, Bob?
In your presentation, you have your 2018 through 20 health priorities, and one of them at the bottom is the addressing health equity through strategic partnerships to promote economic development. And then I take that back to our last board meeting with the health department. There's strategic plan for 18 through 21 to promote healthy and safe living, prevent disease, protect our environment. Now, what do you mean by protect our environment? We've been back and forth for several years over an ordinance to try to clean up part of the environment. Are you taking over that, or is that still a county?
Well, I think, to be honest with you, we always want to protect the environment. And, when you say what is public health, it's like this big, and how can you wrap your arms around it? So, we try to use partnership first and education. Our environmental health office is a big part of that. But there's also public health legal remedies that we use when we need to. So if we have, say, for example, someone who complains because there's something that might be causing a public health hazard, then we send our staff out, they investigate it, and there are times when we have to take action. We prefer to always have voluntary cooperation, because that's typically how things work better in a society, is to have partnerships with businesses and community members. But when we need to, we have a set of remedies that we use that are in general statute, and I always rely on our legal advice. There are times when it's much easier to jump in as the public health director, but it may not be the most wise decision, because it can also lead to other things like a liability that the health department would have to clean up a mess that we just don't have the resources for. So I don't know that I've answered your question exactly, but I'm happy to add more to that.
I think it goes to part of it. At one of our public hearings, somebody spoke to that we didn't need an ordinance because we had the health department. I think that there's a misunderstanding in the community what the health department does or can do or will do. I know in the only case that I know that that the health department has stepped in was back in June of last year. You had a problem in Piney Creek, and I don't know how that problem was brought to you, but your department handled that problem.
Did.
And so do people need to call the health department when they think that there's some kind of a health hazard, a nuisance? Or do they go to the sheriff? Do they go to the county manager?
Well, I think if there's a risk to the public's health that someone thinks may be in the community, they are welcome to call us, and we are happy to go and look at it. I think that what often happens is we have to use our legal guidance to say, is this a public health risk, or is this a nuisance that's really not threatening the public's health? And there's sort of a gray, fine line where I can't really say what fits into what category really easily, but we're always willing to go and look at any kind of concern that the community might bring to us. Happy to investigate. That's part of what we do. Just like if someone calls us and says, hey, I went to this restaurant, I got a piece of glass in my food. Can you go check it out? Or, I mean, we have restaurant owners that they care about their business. They want to give good food, healthy food to their customers. I have no doubt about that, neither do our staff. But there are times when we do investigate based on a public comment, and we always do that when we get feedback. So I think this would be the same type of thing. Another incident that didn't happen in this county, but in another county, we had a big well that the lid was gone, the cover on the well was gone. And I don't know if y'all remember the story about the little girl that fell in the well years and years ago, but I remember, that's immediately what came to my mind. So we went out there and said, we need to get this covered now. So it depends on the situation as to how much we can act and how quickly and how forcefully. But we are always willing to investigate, and we are always willing to look at our options. So I don't know if that answers your
Do
question.
you let the county manager, or do you let anybody know in the county that you've had a complaint filed and you found cause to correct it, or you didn't find cause to correct it? Or is there any way that we know that something's going on?
Well, we keep a complaint log. So we have a log of our complaints, and we have all of the places that we go visit. We have an electronic system that has a database we can look up. No, I don't let the county manager know every time we've gone somewhere, but I think when there's certain circumstances related to something that's outside the norm, I try to make sure he knows about it, because I don't want him to be caught off guard. So, yeah.
Question on the overdose death and the female percentages. Is any research going to be done to try to figure out what's going on in Alleghany?
No, I'm not sure exactly how we might approach that. One idea might be a listening session with some community members to get some more feedback about what they think. That's usually one of the most telling pieces of data we can get, is actually talking to community members. It is abnormal in some ways, but I think probably talking with our folks at the epidemiology branch might be one set of research steps we can take, but I think probably talking in the community is one of the best things we can do. So that's what we're hoping to do in partnership with this Wellness Coalition a little bit more.
Scary numbers.
It is scary, and it's sad.
Anyone else?
Yeah.
Well, and hopefully too, maybe with some intervention with the jail, that we could make some connections and get some feedback, there that would help them, as well as help maybe share some of this data back with the group. Good luck. Thank you.
Thank you.
Anyone else? Thanks a lot. Okay, next is Mr. Nick Hawks. I think another grant opportunity has arisen.
Another grant opportunity.
Before you go to
has
that
arisen.
one, would you speak to the last one? What happened there? The last
Oh,
grant
it's a-
we attempted for,
Yeah, it's on hold right this minute.
they run out of money? Is that what we
state ran out
understand?
of funding, yeah,
Okay.
yeah. So it'll, that grant's open throughout this year, so I'm in steady contact with them.
Contact with who can monitor those funds and whenever it gets refunded.
That's right. Well, I've got Navin on speed dial down there at the GCC, so.
Make a few phone calls and see if I
Sure.
can get anybody down that way that might know.
Well, anything could help,
Yeah.
that's right, if you can.
Okay.
This is, as we do every year, our offshore grants, the VAWA offshore grants. This is again, another grant through VAWA. This is up to a $250,000 grant. What we are looking at won't be nearly that much. The numbers that we ran was 120,000. So with that being said, this is an underserved victims of crime grant. This is a two-positional grant. They are non-sworn positions who would be victim advocates. They will go out. They will go out and assist these victims with. And this is all victims of crime, and we're focusing on rural victims specifically here in Alleghany County. So that's what this grant is for, rural victims of crime or the underserved population. So they'll be doing follow-up with the victims, working closely with the district attorney's office, working closely basically as in a sense as a liaison between the officers and the victims and kind of coordinate things, when the officers, I think it'll help make our office run more efficiently when the guys are out doing these cases and working these cases. You've got that person that can deal directly with these victims. There'll also be an interpreter involved with it. So lots of times we run into a lot of problems when we don't have an interpreter. So one of these positions would hopefully be a dual purpose interpreter, so on and so forth. So, and there's a lot of stipulations with interpreting, especially in the court system, so we have to have somebody that's certified, and that's really hard to find. So this has given us an opportunity to have that. But they'll also work, of course, with the district attorney's office as well, and they'll be real helpful around the office for various tasks directly related to victims. There is a 25% in-kind match. So that means that we can use positions that we already have established and use a portion or a percentage of their salary used as what's called in-kind and then get the funding back. So there would be no direct cost to the county for these positions.
When would this start if it
October.
if we're approved?
Yeah, this is like the DV grants that we already have. This would start in October of 2019.
This would be looking for two
Yeah, it'd be
positions.
two non-sworn positions.
And those positions would be contingent upon this grant being refunded and reawarded. Any other questions? You looking for some act?
Yeah, just the permission to go forward to see if we can obtain
Oh,
it.
and see.
Yeah,
Okay. Then I guess you'll need to, if it did it, then you follow-up work,
sure.
establish the positions and HR and everything. Okay. Well, with that, would there be, what's the pleasure of the board?
I make a motion, we're going to proceed.
Second that motion.
Motion and a second to proceed forward. Any further discussion? If not, all in favor, make it known by saying aye.
Aye.
Opposed, no. 5-0.
Thank you.
Thank you, Nick.
Thank you.
Good luck.
The female prisoners, what's their age group? How does it correspond to the numbers that we just looked at?
Those numbers was, what was those numbers?
2544.
25 to 44.
25 to 44?
Yeah.
I don't have those numbers in front of me, but I would just about have to say that they would line right up.
If you would take a look at that, I think it'd be
Okay.
interesting to try to find
Yeah.
out.
How many female prisoners do we have right now?
Today, I haven't checked today. Most of the time, they're running
Was it 16?
roughly 12 to 15.
Yeah, we've
Thereabouts.
gotten up to 16, it's gotten down to 9, and it's
Yeah.
creeped back up a little.
Yeah.
I think it's
So-
around.
somewhere right around that 12 mark,
Yeah,
about where
around
we
12,
stayed.
give or take
Yeah.
one right now.
Yeah.
Females.
Females, that's females, yeah.
Because somebody can come into the jail or leave the jail 24 hours a day, and we don't, it's hard to have an exact number all the time, so.
Thank you.
Thank you, guys, appreciate it.
Like that in-kind match on that. Bring more of those back. All right, next on the agenda is general business, if I'm correct, and we have some DOT information in our packet, and I think a larger copy there
We've
on
got
the table.
a larger copy right there. Those are taped together sort of to make it look more like the actual map here, so. Start with the Bing map here. Of course, this is 18 Osborne Road going towards the transfer station. We had a public hearing in June of 2017 for DOT to start studying this. At the time, the proposal was to completely close this intersection here. So Osborne would be a dead-end road off Health Services Road. And then Health Services Road would be taken into the state system. I guess as they studied it further, the new plan is not to completely close Health Services Road, but this is the intersection with Osborne. There would be a traffic island put in here and a no left turn sign. So basically, you can turn right from 18 onto Osborne, and you can turn right out of Osborne onto 18, but you would not be able to legally turn left coming out of there. I'll stress legally. There. You can't legally speed either, but I did that earlier today, so those things happen sometimes. Then as we come down to Health Services Road, coming into 18, that would be widened a little bit here. The actual physical asphalt would be widened by 2 feet. The right-of-way is going to be widened by more than that. And then that will be a state-maintained road going forward. Health Services Drive is it's a privately owned street right now. We're not the only owner, it's all property owners technically would be liable for any maintenance, but, it's coming back to us if it is. It's us and the group homes, and there's, I think, one private property owner on Health Services Road. So most of that maintenance falls to us right now, snow removal being a big one that just came up recently. There are 3 property owners that would need to sign a document granting the state, basically a larger right-of-way. We are one, the group homes is one, and then there's one individual that they just need a few feet of his property on a little corner there. He would have to sign that as well. So the document is in your board packet, the agreement that we would need to execute. A right-of-way, secondary road right-of-way agreement.
The verbiage down near the bottom addressing a sign removal.
Yes, there's one sign that we are going to have to remove. It's the sign that says for the health department this way. We'll have to move that sign. And then the group homes has a sign that's got kind of brick columns, Alleghany group homes. That sign's going to have to be moved as well, but that will be their responsibility. And I've talked to Mitch about that from the group homes, and we may help them maybe with some labor or something like that, or some backhoe work or something, but it is their responsibility to move that sign. And then they've asked us to put in a stop sign. Excuse me, let me zoom in a little bit here. Right here, this is the driveway here, and it kind of merges into Health Services Road right there. They've asked us to put in a stop sign and then paint across the road, stop, just to help traffic from being a problem right there once they take over that street.
Coming out of that parking lot?
Coming out of the parking lot. It'd be a stop sign coming out of the parking lot, yeah.
Okay.
Just so traffic on the street continues to have the right-of-way there. So, just minimal effort from us. The advantages to the taxpayers, number one, we want large trucks using Health Services Road. A lot of them are using Health Services Road now, and it's a private road that we own and are responsible for. Once this is done, it's a DOT maintained street, which there will be more trucks using it, but trucks are using it now, and it's our responsibility to fix any problems there. So that's certainly a big advantage. It will help traffic flow tremendously. There are a lot of trucks, pumpkin and tree season, a lot of trucks turning left, going back up towards Bottomley, for example, or to Kathy Shore, either one. So it'll certainly help with ease truck traffic those particular times of the year. Most of our truck traffic is, August to early December, pumpkin season and tree season, as we all know. A lot of county resources, it's like passing a basketball through a garden hose that time of year. There's more people in the county, there's more vehicles in the county, but it brings a lot of money into the county. We all just have to deal with it, so. But this certainly, I think there are a lot of advantages to the county without really any major disadvantages. It's my recommendation that we proceed with the agreement.
Just for the board's memory, on Mr. Franklin, and I think there was someone else that came with him, they were in agreement. And
Yeah, Mr. Franklin's really he's the one been pushing this.
Yeah.
He's the one been behind it.
Yeah.
So they have no objection. They're 100% in favor of the project. He came up the other day when Mr. Bogus was up here dropping off the plans and the contract, and met with him and reaffirmed that the group home is, they're 100% in favor of the project.
Any other questions?
Do they realize how much traffic, have we ever had a traffic count, what goes to what uses Osborne Road now? And I just want to be sure these group home people know that their traffic is going to be extremely heavy.
They know.
Yeah, again, there's not going to be a huge truck increase, because most of the trucks that are turning left are using Health Services Road now. There will be some uptick, no doubt. But yeah, I think there's no formal traffic count on Health Services Road. It's been a private road. I'm not aware of one on Osborne. I'm not aware of one. So
We don't know how many people go to the trash dump daily, or,
we have not really kept that particular record, no. We keep the commercial, the trucks coming in and out, we keep that, we run, during tree season, for instance, we do about 1,300 commercial weights, but that's not the only trucks that come in there, but that's just, during tree season, we do about 1,300 weights, just as an example, so.
then when we transfer our trash, they go right now, Osborne Road, and have to make a really sharp right. And this will help these tractor trailers going south. It'll make it a lot easier, actually, for them coming and going. And then the county, we don't have any responsibility to fix the roads after this. That all goes to the
That's
state.
correct. Once it's completely, it'll be another 6 months to 9 months for this to all take place and the construction to be done. It's flagged out there now. If anybody's been by there are stakes up where the proposed right-of-way is going to be. But yeah, they anticipate late summer this project being done and the road being officially taken into the state system.
Any other questions? If not, is there a pleasure of the board to take action on this?
Motion to approve.
Second.
Motion and a second to approve this agreement. All in favor, make it known by saying aye.
Aye.
Opposed, no. 5-0. Thank you, Mike. Okay, next we have an item under consent agenda. Any questions regarding that? I've got one. I'm just curious that they don't have that much in their budget to cover those books? Or is it just they feel better covering them this way?
Yeah, we were, originally the code was supposed to be changed in last year's budget. Then they told us it was going to be 2 years, so we didn't put it in this year's budget, and then, of course,
They usually
changed it
struggle
mid-year.
over getting the books changed. We want them to have current code books. And might encourage contractors here to
Not
get
that
their
I
own.
would ever disparage our colleagues in Raleigh.
Okay, is there a motion on the consent agenda?
Motion to approve.
Motion and a second to approve the consent agenda. All in favor, make it known by saying aye.
Aye.
Opposed, no. 5-0. Thank you. Item F, public comments. If there's anybody here who'd like to address this board on any matters, now would be a great time to come and do that. Movement, we'll move along to county manager.
First item here is our propane contract. This is a one-year contract. It does not require board approval. We did award the contract to Blue Ridge. Again, they had the best bid. It's been the last several years. They have won the proposal there, so we've had a good relationship. Appreciate the other bid we had as well, but it was a pretty substantial difference there. So congratulations to Blue Ridge Energy on that. Next item I have is the State Department of Transportation that manages all the public transportation systems in the state. They are working on a strategic plan now, and this is just kind of introducing it and inviting comment. And you also have, as part of that, kind of a breakdown of this is the kind of the process they're going to follow, the names of the steering committee members, and then sort of a breakdown county by county. Most local government options we've heard about social services are emphasizing a regional approach, so multiple counties working together. At some point in the near future, we will have to partner with another county on our public transportation. We are funded at an unsustainable level currently. Based on our population, the funding we get is off the charts. It's terrific. We appreciate it, but once the economy starts slowing down, it's not going to be a sustainable model going forward. We've had preliminary discussions from the state about partnering with one of our neighboring counties. Nothing public on that yet, but we've had some preliminary discussions on that, and that will probably have to be the case at some point, or we'll lose funding. And our public transportation system is very well managed. We do a great job there, but again, the funding we get from the state per capita is the highest in the state, and it's just not a sustainable level, unfortunately, going forward. So that'll probably be somewhere in the next 2 or 3 or 4 years. We're going to have to consider partnering with another county or 2 or 3 to have a regional transportation situation. So, but that's going to be part of the state. They will be exploring
Just on
that.
that, just a question there, or a thought or comment, is the funding we're receiving is based on the current funding models that they're allowing us to receive. They have a range that we can apply for, and that's what
That's
we're
correct.
working within what they're allowing us to have.
Right.
It's just, you're saying that they're going to be taking a look at that closer going forward and see that it's kind of a misfit on cost per person. Okay.
Once the economy starts slowing down in a couple of years, we're going to stand out on the reports there. Like I say all the time, some of the biggest arguments I've ever had in budget meetings is over a line item of office supplies. It's $100. You spend $110 or 10% over budget, and why are we 10% over budget? Well, it's $10.
It's not anything that we're going to be looking at anytime soon.
No,
You think it'd be down the road as economy starts to change.
Yeah.
Okay.
Well, and again, even if the economy continues to be strong for 10 more years, regionalism is kind of the way the state is moving in a lot of programs. So it's probably going to happen regardless of what the economy does. But certainly if the economy slows down in the next year or 2 or 3, that will accelerate the program, certainly. So the next thing we have is our funding from the 911 board for the year, which right here, $159,000 is what they have appropriated us for next year. We had about $145,000 this year, so it's almost a 10% increase. So there's 2 sides to the puzzle on the 911 funding. Of course, this is from everybody on your phone bill, on your cell phone bill, you pay a 911 tax, and that's what this money is. There's 2 sides of the battle. One is getting them to approve our budget for the year, which is $159,000. then getting them to actually approve an expense to get paid out of this budget, that's 10 times harder. So we never get as much approved as we submit and as we are allowed to have every year, but it's still, it's good that number is going up for next year, so. And a couple of other items that I have, let me get back to my notes here. We were talking about it before the meeting. There was a fire in town today. Sparta, Alleghany, Glade Creek, and Cherry Lane all responded. We'll appreciate them all for doing that. Call first one now sounded like it's going to be really bad. Turned out not to be very bad, but we're happy that they appreciate those guys responding up here to the restaurant. So thank you for doing that. Through 5 months of the fiscal year, our locally collected sales tax, we're on a pace to do $103,000 more than we did last year. That's $10.3 million in retail sales over last year. So we certainly appreciate folks that are supporting our local vendors. Next meeting during the Chamber of Commerce Spotlight Business section, we're going to be handing out some awards to some of our top vendors for the year. You know, we track our purchases that we buy locally. We've got several vendors that we'll be honoring for the ones we did a lot of business with during the year, so something everybody can look forward to. If you are a singer or a dancer or an actor, Tweetsie Railroad is having open auditions for this coming summer season, January 26th and February 2nd. At Tweetsie, 9 a.m. You don't need an appointment. You can just show up and bring your shiny shoes or your throat lozenges or whatever you need to audition if you're interested in that. So it's a great regional resource that we have there at Tweetsie. And again, anybody that would like some singing or dancing or acting experience, that's a great place to get started. So we encourage you to do that. Magicians are also magicians, that's the other category. So if you are a magician, so encourage you to visit with them.
To be sometime done with these budgets, but
We do a lot of tap dancing in these meetings, I know that, so some of us should go apply. Last week, we awarded our contract for our new ambulance to Northwest Emergency Vehicles from West Jefferson, and they will be, part of that will be the box will be coming from AEV, which is in Jefferson, so again, that's the closest vendor we could award that contract to. It also came in literally a few $100s under the $155,000 budget, so at least it's under budget. AEV boxes are the best by far. We're happy to have that. I know they have about 300 employees, and I know, probably 10% of those are Alleghany County residents. I know up Bill's Way, Piney Creek, a lot of folks work over there, so we're glad to support that. There was no vendor in county, but still regional vendor is always a good way to go, so we congratulate them on that. Couple of meetings ago, Jim Brown came and talked about the new software, the Rec Desk software for online registration. That is available now. This is the recreation page on the county website. Click right here. It says register for youth sports or reserve facilities. That will take you over to the new Rec Desk page. So for example, we'll take a look at a facility. If you want to reserve, let's say, the picnic shelter at the Veterans Memorial Park, you can click right here and go through the calendar and do it that way and pay as well. All the youth sports registration will be on here. Jim and/or Megan will be filming a tutorial video this week, and that'll be up on the website as well to walk you through how to use the new software as well. So I encourage everybody to do that. I know it's tough to get into the office here between 8 and 5, Monday through Friday, particularly if you work, in Galax or somewhere. You can't always get here. So, I'll be able to do that from your home anytime, 24/7. So I encourage folks to take advantage of that.
Why are we taking registrations for the Grayson County High School gym?
We're not. That's just, there's still some tweaks on here, so that'll be coming off. Yeah, we can only reserve ones with the green on the side here, so. we would not be taking any reservations for that. Statewide Christmas retail sales this year were the highest on record statewide in the North Carolina, so that's certainly good news for our state sales tax figures. The first 5 months, locally, we've outpaced the state number tremendously, but I guess the state will be catching up a little bit as the November and December numbers come in. So that's good for the statewide economy. And the last thing, I just want to assure the citizens of the county, the government shutdown does not apply to your local county government. We are all here working hard every day. There is a federal government shutdown, I know, right now, but your local services, your sheriff's department, your ambulance services, recreation, tax office, everybody's here and doing business, so that has not affected us. We do have some federal funding that if this thing drags on into, say, March, that'll eventually run out. It's unlikely that's going to happen, but your local county government has not been affected at all by the government shutdown, the federal government shutdown so far. Just wanted to assure the citizens of that. And that is all I have.
Thank you, Mike. Next on the list is under Commissioner comments, is a proposed retreat agenda. And that's all it is proposed. It's up for discussion. We can change it, we can scrap it, we can scrap the whole retreat. But these are just some items that Mike and I had been discussing, and the boards had different conversations about, and so we just kind of compiled a list, probably more than we would have time to get to. The retreat dates are the 29th and the 30th, and we're planning to have it at the conference room at the BDC. So look at this list, give feedback. We could probably finalize it at our next meeting if you want to.
You want our input by email?
That would be fine. And any additions or some of the things will take a while. Once we sort of get everybody's ideas, we'll try to put it together with a timeline so that we can move along on a schedule. I could see us getting bogged down on a few of those items, some of them not so much. So, no, not us. So look at that and provide any feedback you feel necessary. And with that, I'll start to my far left with Commissioner John Irwin.
Roll Tide.
Commissioner Larry.
Come on,
Prince.
Tigers.
Bobby.
Alabama does play tonight against Clemson.
I'm hoping that their bus breaks down and they don't actually make it to the game.
Well, one reason that's so important, that was the first time Alleghany County was ever mentioned on national television, is when Jerry Duncan played for Alabama. So that's why there's a lot of Alabama fans in Alleghany County.
Yeah, there's about a 6-foot-tall poster of Mr. Duncan in the recreation office right now. So.
Yeah.
Commissioner Bill. No comment. Well, with that, would you make a motion to adjourn?
Second.
Motion and a second to adjourn. All in favor?
Aye.
Those that are not, leave.
And none of you mentioned that Dan Brooks, who was the defensive line coach,